Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun.
Hey guys, do I have the show for you today? We're going to be talking about Sculptra and Aquagold. And I'm so excited to have some more of Dr. Grunberg's people on the show. We have Kate, who's her nurse injector. Hi, Kate. We're doing good. And we have Kristin, who's the esthetician at Allure Plastic Surgery. I'm doing good. I'm so excited to have you guys on because there's going to be so much juicy stuff talked about on this episode. So like I was telling you guys earlier before we started recording, I'm looking at my face and thinking, hey, that doesn't look like it did before. What is going on? So now I'm in my 30s. I'm 34 and I'm starting to see like, okay, I see where this is going. And I know from my experience that if I want it to look how I want it to look, I got to address it early. I got to start doing things now before, because I'm planning to have a facelift, but not right now. So let's push that a little bit down the line and do some other things. So today, one of the things I'm exploring for myself is Sculptra. And I love Sculptra. I've been a big Sculptra fan for a long time, over 10 years since it's been on the market. And so I already knew, okay, I'm probably going to get some Sculptra. And I thought, let's use me as the example so we can talk about Sculptra, because I know I'm not the only one dealing with facial aging and volume loss.
Yeah, 100%. So a big part of, obviously, as we age, so in our 20s, right, we have that beautiful, youthful, super plump, really volumized skin. Honestly, a lot of women in their early 20s kind of hate it. They're like, oh, I hate that I have these big cheekbones. And I'm like, oh, whoa, you're going to be super pumped to have these in your 30s. So what happens is, obviously, we lose collagen and elastin over time. Collagen is a structural protein that actually helps hold your face in place, right? So it's what gives your face structure. It's what gives it volume. It's what helps with wrinkles and texture. So obviously, every year as you get older, that collagen production slowly starts dropping off. And it gets worse as you're around perimenopausal, right? So when you're just pre and post-menopausal, that collagen production drops off dramatically. And obviously, a lot of times that's about when women are thinking about facelifts, right? Your late 40s to early 50s. Obviously, some people push it off more to their 60s, but at that point, you're thinking more like a deep plane facelift, something a little bit more invasive. So there are facelift options in your late 40s to early 50s, but obviously what we're trying to do here is push that off for as long as we can. Can we do it with injectables first, kind of get it where you're like, okay, this is good. I look great for my 30s. I'm happy with this. Let's continue this on until we're like, okay, no more injectables. It's time to switch up to something else.
Absolutely. So volume loss is one of those things that I feel a lot of women don't really realize where it's coming from or why, because as you know, I'm sure women come in and they're talking about their nasolabial folds, but it's really not about the nasolabial folds. So tell us.
Yeah, so when you have bone loss over time, and women are more likely to have bone loss than men more early on, right? We tend to have a lower vitamin D production. And so if we don't already support that, you're going to have more volume loss. I'm going to use Kristin as a model because her face is right here. But what you see in women especially is we see deepening of nasolabial folds. We see recession of the chin and of the prejowl sulcus along here. That prejowl sulcus is that connection point between your chin to your jawline. And a lot of women see this and they're like, I have jowls. And I'm like, well, you don't really have jowls. What you have is you've had this cheek fat pad descend down and you've had your structural bone actually lose some density here. And because there's not a lot in front of this, you're seeing that bone loss really, really easily. So that's kind of what brings Sculptra to the forefront, especially when we're in our 30s and 40s, right? You still have amazing collagen production in most cases. It's just slowly starting to drop off. So if we can start supporting that, you can keep these lifted, keep everything where we want it to, and then basically contour and support with hyaluronic acid filler on top of your Sculptra. So it's not either or. It's not just using Sculptra or just using filler. Most of the time, and especially since you mentioned your last episode about facial balancing, a lot of times it's a combination of those two products or multiple modalities, right? Doing stuff for your skin with Kristin, using Morpheus, using Aqua Gold, which we're going to talk about in a little bit, for doing some stuff to the surface of the skin. So Sculptra is a product made out of PLLA, or poly-L-lactic acid. What it is, it's a silk protein that mimics a micro injury under your skin. And that broken down means it's a product that you inject in the deep dermis to tell your body, hey, I need you to create more collagen. I need collagen in this area. I've created a false injury. And that's what that product's actually doing. So the product itself doesn't fill. It doesn't work like an injectable filler like hyaluronic acid, where I push it out of a syringe, holds its place, it's a clear gel. What it is instead is it's a volumizer. And that means I can't choose where I contour, right? So Kristin came to me and said, I have this spot right here I don't like. I'm not using Sculptra for that. We're using filler. But if Kristin says, man, I've noticed my cheek fat pad is kind of losing volume. I feel like my nasal labial folds are getting heavy. I feel like I'm getting some wrinkles. My texture has changed. What do you suggest? And then we kind of go into, hey, I think what you probably need to think about is Sculptra to stimulate your collagen. What makes it beautiful is it's very, very natural looking, right? And since you know stuff about Sculptra already, is that you don't see a perceptible change. It takes 3, 4, 5 months, and we're talking multiple rounds of Sculptra. You always do a little bit of Sculptra at a time, wait 3 or 4 months and say, okay, that looks dope. That's looking really good. Do we need to add more, or do we need to contour? Do we need to come back for skin? So it is a product that lasts a long time, 2 to 3 years on average, and you're injecting. The rule of thumb is every decade that you are old, you're putting that many vials in your face. Obviously, I hesitate to say that because some people have beautiful volume in their face, right? And I'm like, oh, okay, woohoo. We don't need to put 3 or 4 vials in. That's way too much. So it is definitely customizable based on what you see across your face. If you're like, man, I only have a little volume loss, maybe we're using 1 vial. If I'm like, okay, you've lost a lot of weight or you haven't really taken care of your skin for a long time, we may need to pump you up with a little bit more.
I want you to go into details for our listeners. Usually, how does a regimen of Sculptra go? Like, what can they expect when they go see a provider for Sculptra as far as what you're supposed to do after, all of that stuff?
Sure. Yeah. So Sculptra, when it comes to me, it comes as a powder, right? So it is not pre-mixed. That's something I do. So you reconstitute Sculptra. So it's actually able to be injected in the face, right? I obviously can't inject powder into your face. So my job is to reconstitute that in a safe way. So I use bacteriostatic water and lidocaine. The lidocaine in that product is to help with a little bit of local anesthetic when I inject it, because Sculptra can burn a little bit when it goes in. So first things first, I always do a consultation for Sculptra, meaning you don't come in and get it same day. We sit down and talk about it, because you're right. There's some really serious aftercare with Sculptra because it is a long-lasting product and it is not immediately dissolvable. So HA, or hyaluronic acid filler, which is what most people are comfortable with and kind of know stuff about, it's immediately dissolvable, right? There's an enzyme that breaks it down. In this case for Sculptra, there's not something that breaks it down. So we need to make sure it's injected correctly. So you come in, let's say Kristin and I are talking about it. Kristin's decided we want to go ahead with it. So then we talk about how much does she need. I tend to limit people to 1 to 2 vials at a time. Because it is mixed with water, it's about 9 cc's of liquid being injected in your face at a time per vial. So if I put 2 vials in, that's 18 cc's of liquid. Now that's not a lot of liquid, but in your face, it's a significant amount of liquid to have put in at once. And as we know, the particles themselves are what we're trying to actually place in your face. The water is just a medium to get it in. So your body absorbs the water, leaves the particles spread out. Mm-hmm. So let's say in Kristin's face, I injected it along her cheeks, right? She wanted volume in her cheeks, which is one of the places that Sculptra is on label to use. So I put it in her cheeks, I massage in her appointment. I'll teach her about massage, which we'll go through here in just a second as part of aftercare. It's going to be obviously swollen today and tomorrow. Give it about 24 to 48 hours for the liquid to all be absorbed by your face. What's going to be left behind is deep dermal. Those particles are going to be spread out. Those particles work like you're seeding a garden. And I know that's like the dumbest analogy, but it is the one that we always use because it makes the most sense to everyone. So you're fertilizing a garden, right? You're going to spread those particles out, and then they're going to start start helping things grow. So that's all Sculptra is. It is seeding the garden and letting your body know, hey, we need more collagen here. And your body's like, oh, sure, let me take care of that. So here's where the aftercare for Sculptra comes in. I place my Sculptra using a cannula most of the time, which is a blunt-tipped flexible needle. So rather than using a sharp needle, I can use a blunt tip to go multiple directions, less injury to your face, less soreness afterwards. Generally 1 to 2 poke holes to do a whole side of your face, depending on how many areas we're putting Sculptra in. So it does make it really nice in that you're not super bruised afterwards. So you're always going to be sore after Sculptra gets put in. It's really nice the day of, you're not sore because I trick you with lidocaine. The lidocaine, you're like, this is the easiest thing I've ever done. But the next few days you are sore. So the biggest thing with Sculptra as far as aftercare is you need to be able to massage your face because those particles want to clump together after they've been put in your face and they're attracted to one another. We obviously want to keep them spread out in that whole area. If they all clump together, what's going to happen? I'm going to stimulate collagen only in one place, and you're going to end up with what's called a nodule. Sculptra nodules are different from hyaluronic acid filler nodules, okay? So HA filler nodules are called late onset nodules. They generally relate to someone who has an autoimmune condition. So different in that they're not that kind of nodule. This nodule means we stimulated collagen only in one spot. Your body did its job. We just didn't get it spread out like we should have. So a big part of Sculptra is massaging. Typically the massage pattern is 5 minutes a day, 5 times a day for 5 days or longer. Obviously, each provider has their own rules. That tends to be my rule. It's easy to remember. I know everybody can do it. If it's easier for people to massage 2 minutes a day, 10 times a day, or 15 times a day, that's fine with me too. I don't mind if people use their hands, if they use a gua sha tool or a jade roller, but something that's going to put some firm pressure. And we're always going to massage away from the mouth and away from around the eyes. Those are 2 places we definitely don't want Sculptra to end up. You have sphincter muscles around there, right? Circular shaped muscles. It's the one that makes you go, oh, or makes you able to wink at people, okay? So please, wink at me. So we know that we don't want to get particles anywhere near those muscles or in that area because those muscles are constantly contracting in a different direction than typical muscles in your face. So obviously those particles are more easily clumped together, can form nodules. The tissue around your mouth and your eyes tends to be thinner as well. So we stay away from those places. So Sculptra is great, like I said, for volumizing in cheeks. Preauricular, which is this hollow right in the side right here, right? It's the Bella Hadid hollow, as I like to call it. You want to look like a supermodel. People want some of that hollow. When you're 50 years old, though, you don't want that hollow anymore because then you start looking cadaverish or gaunt and people are like, oh, are things okay?
Are you all right?
And that's what you feel. Yeah. And so a lot of times I have my older women come in specifically for that, or people that have had massive weight loss, right? They tend to lose a lot of collagen because they're losing weight very quickly. And they're like, my face feels like it's melted. So we can use it there. I do occasionally use Sculptra in the lower face, which is that pre-jowl sulcus, chin shadow, chin area. The problem with that is that it's a very, very highly mobile area. Meaning you have lots of muscles that work together to make your face.
This is where I'm starting to see, I'm like, hey.
Oh no, I told her the other day, I said, hey, when we do our Botox, can we please do something about this? This right here.
That's everyone. So you can use Sculptra there. You do have to be very, very careful though. I have actually had one patient that's had a nodule there. She had a very hyperactive lower face. We put Sculptra in. I said, we're going to have to be super careful and put a super small amount in. We did it. She massaged correctly. She followed the rules. She still has a very, very small nodule. It's very deep. You can't see it. If she puts her tongue against it like that, you're able to see it. So obviously that didn't bother me or her, but it's one of those things that I always keep in mind. And it tends to not be a first time area. That patient has had multiple rounds of Sculptra, has always been very happy. So she was like, you know what? I'm willing to try this out and I'm okay if that turns into an issue. I know it'll be deep. It will be non-visible. But for new people, that's not a place that I'm like, oh, let's just put Sculptra in your lower face. They need to have toxin in there first to actually stop that muscle movement so that the Sculptra can absorb correctly and work correctly. So that nodule risk is always there. In the 2.5 years I've been placing Sculptra, she's my first and only patient that's had a nodule. So it's not super common. Like I said, lower face tends to be the most common place for that to happen. So we just are very, very hesitant about putting it in there. And I'm going to have a very serious discussion with you. Nodules eventually disappear, right? So obviously, if they're done correctly, it's placed deep under the surface. If you got a nodule, you're not going to be able to see it. But there are some areas where it is a little bit more common. Temples is one of them, right? Temples is an off-label area for Sculptra, meaning the FDA has not given us approval to use it that way. But as injectors, we typically use stuff off-label a lot of times. So that's not an uncommon thing to do. But Sculptra in temples is beautiful, has to be diluted very, very correctly in order for it to work correctly and for you to not possibly run the risk of nodules. Obviously, temples, you're going to be able to see a nodule right away. Those nodules just have to go away on their own, or they have to be surgically removed. And so that's why we're so careful about using Sculptra in the right candidate, is that if for some reason I'm like, ooh, I don't think you're going to follow my massage rules, you have an autoimmune condition, or other instances where I'm like, oh, okay, this maybe not be the best choice for you. We may think about fat grafting surgically. We might think about filler instead, or we might come back to Sculptra and use very, very teeny tiny amounts over a time.
So you just touched on it. When do you say, you know what, it's probably better for you to see Dr. Grunberg for facial fat grafting? How do you decide, or what makes you go one way versus the other?
Sure. So a big part of it has to do with, one, what your budget looks like and your downtime looks like. If you have the budget and the downtime to have a $10,000 to $12,000 facial fat grafting surgery, by all means do it. My face is facially fat grafted. Our other plastic surgeon, Dr. Gronitt, who's a facial plastic surgeon, actually fat grafted my face a couple of years ago. So I, with full confidence, say I'm all for facial fat grafting.
Tell us about it.
But that, of course,
tell us, how was you? Tell us all about your facial fat grafting experience. Since this is what the show's about. Tell us about your firsthand experience.
Oh, for sure. So I had mine done because I had been placing filler in my face, and my face requires, for what I like it to look like, which is about what it looks like right now, I require a large amount of filler. So I'm using somewhere between 6 to 8 syringes of filler in my face to maintain this shape. Now, most people are going to watch this and see this and be like, there's no way. That doesn't seem likely. But I do have very flat features to the side. So a lot of this is all manufactured with filler. So I was running into that where I was like, okay, every time I put filler in my face, I run the risk of a vascular occlusion. I run the risk of this not lasting me long term, nodules, just other issues that come along with using filler. Do I want to do this, or do I want to balance this with something that's a more permanent option? That's kind of what led into that. I was already going to have him liposuction under my chin and jawline. So I'm already getting sedated. I'm already paying for anesthesia. Let's go ahead and go the next level up. So facial fat grafting is considered semi-permanent, meaning as long as you don't gain or lose more than 15 to 20 pounds, it's going to maintain where it's at. You're going to maintain about 30-40% of what was placed initially. And you're maybe going to want to do that every 10 to 15 years, right? Because just like the rest of your body, fat changes over time. And Dr. Gronitt tends to be very conservative, which I like for facial fat grafting. I would rather have to come back, put a little bit of filler on top of it versus being like, oh, wow, I got some cheekbones now. Interesting. Because it's much easier for us to go behind and modify with lasers, modify with filler, and then kind of sculpt a little bit more. So he facially fat grafted. He took a little bit of fat from my inner thigh, fat grafted under my eyes, my nasolabial folds, my chin, and my cheeks.
It looks beautiful.
So kind of, thank you. Since then, I've probably placed about 4, maybe 3.5 to 4 syringes of filler in my face. So cheeks and chin, I tend to maintain, as well as marionette lines here with some filler. The experience was wonderful. I was sedated for it, so I wasn't completely asleep with general anesthesia. Most people choose to be completely asleep. I have a genetic condition that does not allow for me to use anesthetic gases, so it's a lot easier to sedate me with propofol, which is the substance that puts you to sleep, versus trying to do general anesthesia on me. So if there's an option, a lot of times we'll do a propofol sedation instead for me. But it's a beautiful option. And like I said, if people have the budget and have the downtime, right? 2 to 3 weeks of being a little bit bruised and swollen, you might have to wear a head wrap. So if that's something that's an option for you and you have enough facial fat loss, okay? So if you have very, very minimal, right? Like I look at your face and I'm like, oh man, we could get away with 2 syringes of filler. Okay, 2 syringes of filler is $1,600. If I do that every 2 years versus you spending $10,000 to $12,000 on facial fat grafting, which one is truly a better option for you? That's a personal choice at that point. But if you come to me in your mid-30s or early 40s and I'm like, okay, we have a lot of volume loss going on. I'm going to need 10, 12, 15 syringes of filler over the next year and a half. Are you open to having facial fat grafting done? Sometimes then it becomes cost analysis and safety analysis of, is it better to do this and then come back and see us for little tweaks versus actually going in and being like, oh, let's load your face up with product that's going to dissolve in a couple of years.
Oh my God, Kate, I can't tell you how many times I've talked to women on the phone or in a consultation where they've told me, I got 12 syringes at my last appointment, or I got 10 syringes or 9 syringes or 8 syringes. And I'm like, you could have just had surgery. You could have just had it fixed permanently. What do you mean you got 16 syringes of filler? Who did that to you? But it's happening out there. And there are some women who don't want to have surgery at all, and they would rather go the filler route. But you brought up some really good points, which are the risks associated with every time you have filler injected. So we've talked about it a little bit on the show, but I've never really gone into detail because I haven't had a nurse injector on and really go into the detail of the risks. And this is, something that my girls are doing daily. They're getting filler. So you know what we need to know.
Yeah, for sure. So there's obviously with Sculptra, there's a few less risks. Okay. So I'll touch briefly on that. I'll go into like the main risk with hyaluronic acid filler. So with Sculptra, the nice thing is it's a very thin product. It does not cause vascular occlusions, which I'll kind of explain what those are in a second. Because a lot of times we say that word and we're like, yeah, and everyone's like, I have no idea what that word means. And for us, it's commonplace for us to say vascular occlusion. And Kristin knows exactly what I'm talking about. You know exactly what I'm talking about. But the average layperson doesn't. So that's part of my job is to say, hey, I know you signed an informed consent in the waiting room that you did not read. I am well aware you initialed those boxes and it went right over here and you're thinking about getting your lips done. Let's sit down and have a real conversation about what can happen, what the percentages of that is, what those signs and symptoms look like, and how do we correct them. So with Sculptra, the biggest risk, like I said, are those nodules. Nodules are just so uncommon. I've had one person, we knew she was at risk already. We went ahead and placed that product and we were like, okay, now we know next time in the future, we'd use filler there instead.
I'm gonna vouch for that because I've had an experience with nurse injectors who have been using Sculptra for years and years and years and have not had nodules. So, or if they have, it's very tiny, very, very deep. You can't really see it. So I vouch for that, you guys. It's really uncommon. If you do the massages right, and if you place it right. So if you go to a provider who knows what they're doing, your risk is fairly low.
Yeah, it's less than 1% in all honesty. And of course, it all comes with dilution and how much you're using and all of that kind of thing. So since I've had that nodule, I've actually changed up how I diluted my product a little bit just to make doubly sure in the future I don't run into that again, right? That's the problem with medicine is that I wish I was God. Unfortunately, I am not. And so sometimes things happen and you're like, okay, let me recalibrate and figure this out. And like you said, deep, didn't bother the patient, didn't bother me. We're going to put more Sculptra in her face actually here in a few months because she's kind of ready for her next round in her upper face. So we've accepted that risk for her. So vascular occlusions are not very common with Sculptra. I don't know if there's even really been a ton reported on, none that I'm aware of as far as the big meta-analysis studies of Sculptra, because a lot of them kind of came out when the FDA finally did truly approve it for volume loss in the cheeks. So that's kind of been a thing that Galderma, the makers of it, have been waiting on. So anyways, back to vascular occlusion. So when you place filler in people's faces, there's always risks associated with it. Because filler is an injectable gel, it's made out of hyaluronic acid, which Kristin will talk about a little bit with the Aqua Gold too. It's naturally occurring in your face. However, the manufacturers have cross-linked it into a gel, and that gel has different densities based on where you place it, right? So what I put in, so what I put in Kristin's cheeks, right, is not what I put in Kristin's lips because that would be silly. I don't want something that mimics bone going in something that should be soft, flexible, natural. So obviously filler, based on the area, has different abilities to block blood vessels. So when I put filler in, you're using a needle or a cannula. Most providers draw back or aspirate back on that syringe. What we're looking for is blood coming back into that needle. If blood comes back into that needle, what we're looking at is being intravascular in some way, whether that be a vein or an artery. We know bright red blood that is brisk and comes back immediately is I'm in an artery. Something that's a little bit more slow, darker in color, maybe I'm in a vein. That works about 80% of the time. So 80% of the time, if I aspirate back, I get blood back. I'm like, great, I'm intravascular. I need to pull my needle out, reposition before I place that product. 20% of the time, you can be intravascular and not know it. That is the risk of having a face that's full of very, very small vessels. We unfortunately can't control that. I can't control your anatomy. And facial vessels have a very, very high variation to them. Meaning, I know your nasolabial fold right here should have a facial artery underneath of it. Kristin's might be deep, might be superficial, or might be a combination of both. Her facial artery actually might kind of run this tortuous pathway down here, or maybe it comes a little bit under her cheekbone. I don't know until I've mapped it out with an ultrasound. So there are some safety things you can do. You can map people's faces out with an ultrasound and look for facial vessels. If we're putting filler into a high risk area, and a high risk area involves around the nose, the eyes, or the temples, especially because there's some fossas or little holes there that can cause intracranial problems. You have some very, very small arteries that run to your eye, your retinal artery especially, right? Your retina we really like. That's what gives your eyeball blood so that we can see and things like that. So we're very, very careful with this. So if I was to get filler intravascularly in your face, which has happened to me, it's about a 1% risk. I've had 2 people in 3 years, one in a lip, one in a marionette line. If you get that intravascular, that filler does not move, right? All it does is block that blood vessel because it is a gel, which means it's going to block oxygenation to that part of your face. Lips tend to be a pretty common area for occlusions. And by common, I mean 1 to 2%. Okay. So reminder that when I say common, it is not really common, but it is more likely than me putting filler in your cheeks. So when I do lips, about 20% of the time, your labial artery or the arteries in your lips are actually found in the plane that you inject in. So they can be a little bit more superficial. If I was to get filler in there, it's going to block oxygenation to part of your lip. Your lips going to change colors. You might have pain. You might have numbness. You're going to maybe eventually have pustules and long-term necrosis. Okay. So necrosis is more likely to happen if we don't do anything about it. Okay. Kristin flies to Mexico the next day and doesn't tell me that her lip turns purple and we never talk about it again. She's at more high risk of having that necrosis happen. However, if you inform your clients, which I always do, whether they want to hear me talk about it 400 times or not, every single time I put filler in face, I'm like, hey, these are your signs and symptoms. You're going to call me in the next 24 hours if any of these things happen. Our phone number for our office for any of us goes to an after hours number. That means an answering service 24/7 is answering that. Then they immediately call me and they call Dr. Grunberg. And then we come in together and we dissolve that. The nice thing about HA filler is that if you get a vascular occlusion, it is dissolvable immediately. Within 2 to 3 hours, we can completely dissolve that product, get that out of the area of your face that's causing that occlusion, and reperfuse or bring blood back into that area so we can fix that issue. It's not, it happens and we're like, oh man, that's a real bummer. Sorry about that. That's not how it works. There's absolutely a protocol. We actually have a set of protocol here. So we have written protocol. We actually have a little bundle of products and supplies.
Yeah, your cash card.
And then oh, absolutely. Yeah. No, we have an entire thing. I have EpiPens. I have chewable aspirin, and it's written, right, for each of the providers. So if anybody has one, we know what to do. You don't have to think about it. We will always come in as an RN MD team. There will be 2 of us to dissolve an occlusion. That means one person stays out of the room, the other person is in the room, and then we're going to switch places and check perfusion. That helps prevent us missing something or us being like, I don't know if it's dissolved. No, you have another person that's backing up and checking your work. If Dr. Grunberg has an occlusion, which she has before too, I'll be there to help her out. So it's always a team effort when you're getting a complication happening from filler. So that tends to be the most common complication with filler. Like I said, 1 to 2% of the time. So it's incredibly rare. I think overall as a practice, we've had less than 5.
And I think this conversation just goes to show the importance of why you cannot have filler done at the hair salon. Why you cannot have filler done in somebody's backyard or at a, party. These are the complications that can happen. And as exciting as it might sound, it's really probably not the right thing to do, to have filler done by somebody that's not an RN, an FNP, or an MD. In Texas, there's some ways that they're getting around it, but
very loose rule. But Kay won't even let you travel after she's filled you. You're not allowed to travel for
24 hours.
24 hours.
So I do stay pretty conservative on travel restrictions because I do have people fly in from out of state that I see. They have a full 24 hours that they have to remain. If they go back within that 24 hours and it is against my recommendation, they need to have a provider that can see them where they're going. Obviously, we know high altitudes, which is what happens when you're flying, is more likely to decrease your oxygenation. So it can actually make an occlusion much, much worse too. So we avoid traveling. And if you live more than 2 hours away from me, you either need to have a provider where you live that can immediately dissolve you with Hylenex and understand how that process works, or you need to be able to come back and see me. Hylenex is a really serious thing to have in stock. We carry 48 vials of it. That is enough to dissolve a whole bunch of people's filler.
That's a lot of Hylenex. That's a lot. So good job, you guys. I can hear from everything that you're saying, all of the green flags that I'm usually like, that's a green flag. That's a green flag. There's green flags everywhere because safety to me is super important. And these conversations that we're having. These are the conversations that I want our listeners to hear, because somebody might not be getting this information and they're going in to have a procedure like this. And the conversation that we're having here now could raise alarm bells in their brain when they're like, hey, so do you know what Hylenex is? And if the person says, Hylenex, what's Hylenex? Then they can say, oh, you don't know what Hylenex is.
No, that's 100%. Your provider should be able to tell you about complications and if they've had them and how they've managed them. To me telling you, oh, I've never had a complication, it is not a good thing. Because complications do happen. Have I had them? Am I able to learn from them? And am I able to tell you about them and say, hey, this happened to one of my clients. This is what it looked like. So if you have this, we now know what to do about that thing. The same thing with things that Kristin does, right? Have we had issues with people having hyperpigmentation? Yes. Do we have them very often? No, almost never. So when they do happen, we've got a protocol for that. Yep. She has a compound for it. She's got medication, and we have a plan for what to do next, because acting like we are so good that we don't have complications is just silly. That is just an unrealistic expectation to set, and especially for a medical procedure.
I saw it online, and it was like the question, it's not if you're going to have a vascular occlusion as an injector, it's when is it going to happen, and how do you know how to handle it?
Absolutely. That's a huge deal.
So we're still on Sculptra. So one of the things that I want us to talk about, because I get asked about it all the time from my very thin girls who don't have a lot of fat to do a real BBL with fat transfer, but they still want a little bit of booty. They want some booty. So we talk about Sculptra BBL. So, hey, I know you do these. Why don't you tell us a little bit about your experience with them?
Sure. So Sculptra can be used obviously off-label. So Sculptra BBL is not an on-label usage for this product, meaning the FDA does not have an approval study for it. It is not recommended by the company because they can't legally, right? So they can't give you advice on how to do this. They can't train you how to do this. So this is something that I've been trained on by Dr. Grunberg specifically. So a Sculptra BBL involves injecting Sculptra in the buttocks to enhance, right? So just like you said, the real fix for needing a BBL is a Brazilian butt lift in the operating room with a board-certified plastic surgeon who knows what the heck is going on, because BBLs can be very dangerous. So the gold standard is surgery, okay? And I would say 9 out of 10 times I talk people out of getting a surgical BBL. And I know that does not benefit me as a nurse injector, but it benefits me as a long-term advocate for my client, meaning I want to see you for the next 10 or 20 years. I don't want to see you once. I want you to do the thing that's best for your body. And most of the time it's a surgical BBL. And every once in a while, just like you said, we have people that are too thin, right? So Kristin's an excellent example of that. Kristin gets to be my model for everything today. So because Kristin's on the thin and athletic side, she does not have enough fat to get a good surgical BBL. I mean, I bet we could probably only get 2, maybe 300 cc's total off of her for liposuction, right? You have to liposuction the fat off. It has to be nice, good, fluffy fat. It's going to get a lot of blood flow to it and blood circulation, because that's what helps the fat stay, and then to re-inject into her buttocks. So for her, it's just not a super great option. Yes, you could do it. Yes, you can spend the $18,000 to $20,000 for a very, very minimal result. Is that worth it for her? And only she can answer that. And of course, the plastic surgeon she goes to see. So I usually recommend if people are on the fence or they are unsure. Obviously, I am not a board certified plastic surgeon. So I like them to go see one and say, hey, this is what I want to do. Is a surgical BBL an option, and what kind of correction would I get with it? If they go to the consultation and the surgeon is like, cool, so you're actually not a good candidate for that, they're going to come back and see me, and we're going to discuss whether or not a non-surgical BBL is a great option or not. So Sculptra will very minimally change buttocks. If you would like a Miami booty that you can drink a beer off of, it's not going to happen. That's a surgical BBL. that's buttock implants, or that's another type of filler. Okay. And because there is no hyaluronic acid or HA body contouring filler available in the US, I can't really speak to that. It is available outside of the US. I will always tell people that that is an option in Canada, but it's also an option in the UK and Mexico. However, finding providers in Mexico and the UK is a lot harder than finding someone in Canada. So that is an option outside of the United States. But of course, I can't recommend that you get something that's not even an option.
Hey, the show it's all around the world, and I have a lot of listeners in Canada.
Oh, awesome. Oh, perfect.
So tell them, because if they're looking for it, they could go look for it.
Sure. So it was just recently approved in Canada. So hyaluronic acid body contouring filler is different than Sculptra, right? Sculptra is only a collagen stimulator, and that's why it will be moderate changes in the buttocks. So if we are looking at someone that has hip dips specifically, right? And hip dips are where your hips dip in on the gluteal muscle, where you don't have that nice round projection. A lot of times that is anatomical. I will say this 400 times and repeat. You cannot change if you have hip dips, okay? You can change your gluteal projection and your buttock projection in small amounts with certain amounts of workout, changing food, that kind of thing. But telling someone that they can work out and get a bigger booty is a lie 99% of the time. That girl had a BBL. Do not let her tell you that it was her hip bridges that caused that to happen. It is not it, okay?
Her hip bridges filled in her hip dips.
Yeah, you cannot fill in hip dips. I can contest to that all day long. I cannot fill these in for the life of me.
So when we have people with mild to moderate hip dips, I can make great changes with Sculptra. It's really nice for cellulite dimpling too in the buttocks. So maybe somebody's had avoli, they've cut those tension bands, but they still have a little bit of dimpling, which is the hardest thing to deal with is cellulite. Or let's say they've had a surgical BBL and one side the fat took better than the other side. That happens, right? You cannot predict that. Sometimes fat will die on one side versus the other. I'll go back in and correct that with Sculptra. The name of the game with a Sculptra BBL is patience and money. Okay. And that is really sad to say, but it is true. They are not cheap. It takes a ton of product. If I'm using 3 or 4 vials in your face, can you imagine how much I need to change in your buttock and add enough product to do that in? So if I'm doing a surgical BBL, I am at minimum using 8 to 10 vials of Sculptra. And honestly, more often, it's closer to 16 to 20. Okay. At $800 a vial, if you put 20 vials in, I'll let everybody do their own math, but you paid for a surgical BBL at that point. Okay. And a non-surgical BBL or a Sculptra BBL is going to last you about 3 to 4 years, meaning 2 to 3, I'm coming back in, we're touching it up. Now, if you have something moderate to change, like, so in Kristin's case, she has nice projection. She just has, I would call them moderate hip dips. You don't have super deep hip dips, but enough that I'm probably going to want to place 4, maybe 5 vials on each side. So that's kind of a process, right? So she's coming in, we're doing the consultation, I'm mapping out the areas, we're deciding when we're going to put it in, and then we're going to put 3 or 4 vials in at a time. She's going to come back in 3 to 4 months. We'll do that same process again until we get to where we're happy. The nice thing about non-surgical BBLs is they're incredibly safe, even safer than putting Sculptra in your face. Because we put the product deep, your dermis is deep in your buttocks, you're not going to have that risk of nodules like what you have in faces. And a lot of times they're a lot easier for people to massage, right? You got a nice area to go around a massage versus face where you're kind of trying to be a little bit more careful or gentle. So non-surgical BBLs tend to be a little bit easier recovery time. If you're sore like you are with your face, you're going to be a little bit bruised. I do use a bigger cannula to put the product in, so I do numb with lidocaine on the surface. So I will inject a little bit of lidocaine before I put my cannula in. I do still use a cannula. Again, some providers use a needle for everything. That is absolutely provider choice. This non-surgical Sculptra BBL downside is you can create some scar tissue in your buttock, okay? You got to think, I'm putting 4, 5, 6 vials of Sculptra in, maybe 10 on each side long term. What happens if then you decide to get a surgical BBL? That surgeon's probably going to curse my name a little bit because you've built up some scar tissue from that cannula being put in, and also from creating really, really nice collagen. I hate to say this, but Sculptra produces beautiful collagen. What does collagen mimic? It kind of mimics scar tissue a little bit, and that it's a scaffolding that holds something up. So if I build beautiful collagen in your buttocks and you're like, it's not a surgical BBL after all, then not only am I thinking, oh, what have we done here? But we're trying to be very careful about not creating so much scar tissue that your surgeon then has difficulties in the future.
Let's go on to the next thing because we're going to run out of time and I don't want to run out of time.
The rest of this, you won't hear anything from me, okay?
Hey,
I don't know how I'm going to.
I love it though, because this is exactly what we need. This is what our listeners want. the truth, the real, like this is what they're looking for, information that can help them make a better decision. And Sculptra BBL is one of those. I'm always talking patients out of it and telling them they should just go get a real BBL, gain some weight and get a real BBL because they're surprised at the price tag. But it's a non-surgical BBL. It's going to cost almost as much as a normal BBL, and it's not going to last forever like your own fat would. It'll last a certain amount of time. So it's very different. And I've had to have this conversations with my girls who want BBL, they want a big old booty, but they don't have the fat. And I'm like, you know what? You might just have to go on a weight gain journey.
Yeah, that may be the case. Or like I said, only to briefly say it, outside of the US, there's HA contouring filler available. What that is it comes in big syringes. It's hyaluronic acid. It only lasts you a couple of years, but it tends to be a lot cheaper than Sculptra. Again, I cannot condone this because it is not available in the US. I have not put my hands on this product, but I do have clients that have had it done. And so anecdotally, if you are in a place that you have a board certified plastic surgeon, an RN, an NP, an FNP, or a PA that does that, that's something to probably discuss with them and see if it could work for you, because you do see bigger changes because you can put more product in.
That sounds good. I'm going to do some research. Okay.
Absolutely.
So now let's talk about the other BBL. The other BBL.
Broadband light is the other BBL. So when I talk to my clients and they're like, BBL butt lift? I'm like, no, I don't do that. I'm sorry. BBL is a broadband light and it attacks pigmentation in the skin as well as vascularities and redness. So it helps kind of even out texture and tone in the skin. We have the Cyton here. And that is probably one of my favorite machines that I've worked with. It probably gives me the best results that I've ever had. And I'm so glad that we brought it on into the practice.
Kristin, you wrote something on your podcast forum that I want to talk about because I had never thought about it like that. But then I'm like, wow, I did I have that? Where you were talking in your forum about how it was for you after exiting the military.
Yes. So I was in the military for 10 years. I joined when I was 18 years old. And so my entire early adulthood was the military. And so when I got out, my son was a newborn and I was like, oh shit, what do I do now? And I was like, I no longer have that name tape in my rank. So nobody knows me. I'm at the bottom of the line. And so I was like, what do I do? And so I tried literally everything. I was a Bexar County Sheriff officer. I worked in insurance. I went back to school. I went back to 2 schools. I have a business degree and I have an associate's in healthcare. So I did a lot. And so when I had my daughter, I was like, I need to get out of here. Like I need to find a career that I absolutely love. And I did a lot of research in the industry, in this career. I spoke with a lot of estheticians. And I was like, you know what? This is what I'm going to do. This is what I'm going to do. So I went to school and honestly, I absolutely love this industry and I do not see myself anywhere else. So all the rest of the jobs, the prior jobs that I had, I did not feel like I had a home. I didn't feel comfortable. I didn't want to do that for the rest of my life. And then here, like I found this home and I told Kate, I'm going to retire here. Like I have this office in Dr. Grunberg and Kate so much. And I love this industry. It's ever changing, ever growing. I learn something new almost every single day.
That's so true. Something new every day. So part of your journey into being an esthetician, you said that you were addressing your own skin concerns.
Yes. So my daughter gave me melasma. I still have it.
So melasma is hyperpigmentation that happens during pregnancy.
It can happen during a lot of different things. Pregnancy, menopause, any kind of hormonal imbalances or changes, especially during pregnancy, breastfeeding. But a majority of the people that do get it, it goes away because when their hormones regulate, it just kind of goes away. Mine, however, stuck with me. It's mine for life. So my biggest thing is lightening. So that, and I had adult acne. So kind of getting in tune with my own skin is helping me, with the other people and the people that I help and my clients get in tune with their skin and let them know that skin is very slow. It's a journey. Like it's not going to be, and that's what's hard for me but compared to you, because you can get filler all day long and you have that immediate change. You have that immediate instant gratification. With me, we take slow steps. We have to get you on product that can take 6 to 8 weeks for you to see a difference. We're going to do Morpheus or BBL or anything like that. That's going to take a little bit of time for you to get your results. So for me, it is a little bit, I feel people are not as satisfied, I guess.
And they walk out.
But it takes time. Yeah. So I have clients that I've been seeing for a year and just doing hydrofacials alone. I can see their skin change. Mm-hmm. And it is amazing to see. And they're like, oh, yeah. And I said, yes, it takes a long time.
There's not enough I can say about people prepping their skin with lasers and skincare before you spend all of this money with me. I can put filler in your face all day, but if your skin looks like garbage, it still looks like garbage with filler underneath. And a lot of times it's getting your skin with Kristin right and then coming back and putting filler in. And the results are just, they're 10 times better.
Mm-hmm. I have this analogy that you're going to buy this brand new mattress. You're going to put all these things on this brand new, you're not going to put old sheets on this brand new mattress. You want the sheets, you want the brand new sheets, mm-hmm. You want the brand new mattress, you want all of that. You don't want to put old sheets on a brand new mattress.
I love skincare. Skincare and taking care of your skin has been like at the top of my priority list for a very long time since I started in the industry, because I would see, mm-hmm. I had my first office manager at the office that I worked at. She was 60 and I thought she was 40. And when I heard that it was her birthday and she was turning like 62, I was like, what have you been doing to your face this whole time? And it was crazy.
It's all skincare. It is at home. 80% of good skin comes from you doing a really good regimen at home. And that's why I always tell people facials, skincare, Kate for products like Botox or Dysport, fillers. That's where you're going to go and get the best skin is mainly skincare.
I love it. So let me tell my listeners, my girls. So a few months ago in May, y'all know I had my Make It Pop event where we were talking about the things in the industry. And before that, I went to see Dr. Grunberg in her new office. And I had the luxury of Kristin's Aqua Gold treatment.
Oh.
So you guys, my skin.
Tell me about it. I can talk to you afterwards. Tell me about how you're after.
Okay, so I think I did that on a Thursday or a Friday, and the event was on Saturday. My skin looked so good. I was so happy. I'm like, I wish my skin could look like this all the time, every day. I'm obsessed. So tell us a little bit about Aqua Gold.
Okay, so Aqua Gold is a micro channeling injection. So it's not like micro needling where you have the noise, the needles that go in and out. I physically stamp this into your skin. It goes about 600 microns down. So that's 0.6 millimeters down into the skin. And I have this concoction. So it has a vial in there that I get to mix up on how you, what your goal is. So for the most part, I put Sculptra, Botox, growth factors, stem cells, and hyaluronic acid in that little vial. And we've already know about what Sculptra does. Sculptra, creates collagen and all this other stuff. What Botox does is it helps relax the skin. And it helps kind of just make the skin kind of like porcelain skin is what I want to kind of, put it to. And it also helps with sebum control. So it helps with oil control, helps with sebum control. So that helps with texture and acne as well. So you don't have as much oil come out, so it doesn't clog pores. And then we have our growth factors and stem cells, which we use anti-age stem cells for, which is their human growth bone marrow stem cells and growth factors. And it's not embryonic or fetal. It is consenting adults coming and donating their stem cells. And that's what they do. It's lab generated stem cells. And so that gets placed into the skin as well as a little bit of hyaluronic acid for hydration. And I stamp it everywhere. I kind of go over your problem areas. You tell me your problem areas, like say around the eye, and I'll stamp it in probably a couple extra times there. And then when you're done, you're red for maybe 45 minutes?
Yeah, I'm usually red for a little bit longer. First of all, I'm also obsessed with Aqua Gold. The glowy skin afterwards is like life-changing. It barely hurts at all. So people have a really low pain tolerance do super well with Aqua Gold.
Yeah.
and it helps so much with texture and pore size. Anyways, I'm getting distracted. The important part of that is I'm usually red for 2 to 3 hours afterwards. I have rosacea, so I tend to react more inflammatory to things. So if you're on the more alabaster or albino side like I am, you want something that you don't want to have an event that night and then get an Aqua Gold. Definitely 24 hours later, but I'm red for 2 to 3 hours afterwards. Most people, 45 minutes to an hour.
To an hour. There's no numbing. It's completely comfortable. It's so fast. It's a really good event treatment for sure. And it lasts for about 2 to 5 months.
Yeah, my skin was looking good for a while. So if you're getting married, if you have a very important event, if you have something that you have to look your best for, get Aqua Gold. It was amazing. I loved it. So one of the last things I want us to talk about that you also brought up on your form was surgical scars. What are you doing to help people with their surgical scars?
It's one of my favorite ones. So Dr. Grunberg, she does surgeries like mastopexies and tummy tucks. So when you come out of surgery, you have really large scars. Some people don't heal properly. Sometimes they heal like crap. It's just how your body heals. So if you have any hypertrophic scarring or anything that's raised, we have the Profractional from Sciton, that it is a erbium laser that goes deep into the dermis and kind of like regenerates collagen, kind of like flattens out. I had one it wasn't quite keloided, but it was raised. And she was 2 years out from a tummy tuck. And I did one Profrac on her and her scar laid beautifully flat. So Profractionals are the way to go for scarring. And I love seeing it. And I can BBL, which is taking away the redness or the pigment out of the scars too. It's so pretty.
I love that because, the lipo scars, the tummy tuck scars, brachioplasty scars, thigh lift scars, breast lift scars, all of these scars can be treated?
Yeah, all of them. I can even do like scars on the face. Like if you've had a facelift, I've gotten like really close to the inner ear where you have those scars. I've done all types of scars. The only scars that I will not feel comfortable doing because we don't have interocular eye shields is for getting an eye lift.
Those scars heal so nicely. Those eyelid scars heal so nicely.
I know they do, but also it helps with acne scarring. Yeah, people who have had childhood acne and they still have some pitting, it comes out beautifully.
So this is something we talk about all the time. So if somebody who does have acne scarring and they do have pitting, I know there's some places where they'll do some subcision to help release the scarring from underneath, but treating it from the top, what kind of results do you see with that?
The Profractional or the other one?
Which one do you use?
We use the Profractional. So we use the erbium laser going into the skin. I've seen some fantastic results with that.
They're beautiful. I do them too on people. And for pitting acne scars, you're going to do multiple of them. It is not a one and done, but the change even after one is phenomenal because if you stimulate that deep collagen, you can really bring that pitting up. You can combine it with subcision too. So it's not a one or the other. A lot of times it's a combination of, hey, let's go ahead and do some Profractional. Maybe you're going to come to me. I'm going to subsize and fill them. Maybe you're going to go see Kristin for some microneedling on top of that Profractional. But Profractional is beautiful to hit that deep dermis. And Kristin is so incredible at that. I mean, she really is. Like she takes full care of my skin. Okay. So I get 2 to 3 BBLs a year. I get some nano pills done and some other options, but she has a really good eye for what people need and just being very thorough of explaining to you, hey, you're on the skincare, you're doing this. It's time for the next step now. Rather than just being like, oh, you bought skincare? Okay, bye. I'll see you later. She's on you to make sure you're getting that next step.
I love that. I really do. So the most important thing, just like for Sculptra, is aftercare. So why don't you go over some of the aftercare after getting one of these lasers or even after the Aqua Gold that I had? There's always aftercare.
Always aftercare. So Aqua Gold, I'll start with that one because that one's the easiest. No makeup for that day. You can wear makeup the next day. You're going to have redness, maybe some irritation. So a gentle cleanser and a really good fragrance-free moisturizer is going to be the best because you don't want to irritate the skin even more. The next day, you can start all your stuff again. Vitamin C's, anything that has actives in it, like retinol or anything like that, those can be started the next day. So that is all you need to do about Aqua Gold. Aqua Gold's the easiest one. Now, when we do BBL, that would probably be the second easiest one because there's really no downtime for that. Your pigment's going to come out a lot darker. You're going to look in the mirror and be like, what the heck? You're going to see pigment that you didn't even know was there. And so all I ask you is just gentle cleanser. You can wear makeup for about 3 hours after the procedure. You're going to be red, possibly a little bit swollen. So I wouldn't do anything till the next day. And then you're going to have these coffee ground like things. It's going to look like paint splatter all over your face almost. With coffee grounds, I don't ask you to exfoliate them at all. Just leave them be, moisturize your skin really, really well, and then they'll eventually fall off. So they'll fall off on the face about 7 to 14 days. On the body, it's a lot longer. You can expect to have coffee grounds all over your body for about 3 weeks. Body's a lot more slower to heal. Now, the profractional is a lot more in depth. So you're going to have really, you're going to bleed on the profractional. That's going to be inevitable. So we use Aqua 4 as an inclusive, and then we just have you just moisturize. Stay out of the sun. Always wear your SPF with every single one of these procedures. Any procedures that we do, you'll wear SPF.
This is the question I want to ask. Do you have a preference on what kind of SPF they're using?
Yes, absolutely. So my favorite out of everything that I've ever tried is Skin Better. Skin Better, their SPFs are amazing. I've worn mine to the beach in Port A and I never got burnt. I love that one. I always burn at the beach. That one is such a good one.
What about
100% Skin Better? That's all I'm wearing right now.
Mm-hmm.
I have the Skin Better Compact on. If people are on a budget, they're not able to afford it, my next option is going to be Super Goop. That is non-medical grade. Mm-hmm. I don't tend to like to recommend non-medical grade because obviously we work in medical grade typically, but honestly, everybody has a budget and I get that. If you're going to use a non-medical grade, my option tends to be Super Goop from there.
Oh, that's a good one.
I do love Super Goop. I have that one right here. The tinted, I've tried a bunch of sunscreens from all different types of skincare lines. I love the Skin Better one. And I do love the Super Goop. I got both of them here.
Yep.
Because I'm a sunscreen girl. Let me put my sunblock on.
You need to be a sunscreen girl.
100%. Mm-hmm. That is, if you do nothing else but cleanse your face, use a good quality medical grade moisturizer and sunscreen. Just put sunscreen on, please.
If you want to prevent aging or if you want to prevent changes to your skin, you have to use sunscreen.
100%.
Absolutely.
All right, guys. So that was really all the time we had for today. I think we covered so many great, wonderful things and we got such juicy details that you can't hear anywhere else, right? Unless you're in the office. That's why I like the girl talk. Thank you guys so much for coming on today. And if our listeners want to come see you, where can they find you?
Sure. So you can come see us at our office at 16530 Huebner Road, Alluring Aesthetics. Both of us also have Instagram accounts and Alluring Aesthetic does as well.
Your Instagram accounts will be tagged in the episode description. So just click on the link if you want to go check out their Instagrams and give your Instagram handle.
Sure. Filler Queen Kate.
And mine is Kristin_Gonzalez.
All right. You heard it here, you guys. If you want to have some sculpture done or if you want to get your skin in check, I know you won't, Kate, but Kristin, do you do virtual consultations for skincare?
I don't typically, but that's probably something that I would like to start to try to do.
Yeah, I know that.
Yeah, I would.
Because you can usually do your first, let's get you started on skincare first.
Yes.
Consult.
Absolutely.
Okay.
Yeah. No, that's something that I need to start looking into and implementing for sure.
Mm-hmm. So if you want to go see Kristin or Kate, you know where to find them. These are Dr. Grunberg's. You guys know the MILF maker. So these are Dr. Grunberg's girls, and they're going to take really good care of you. Okay. That was today's episode. Thank you guys so much for coming on. I'll see you next week.
Thank you so much for having us. We appreciate it so much. We can't wait till next time. Bye.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar.
things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you. Let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.